Hello students, welcome to this session. Let's study autoimmunity and disorders. Learning objectives are definition, mechanism of autoimmunity, classification of autoimmune diseases, and lab diagnosis. Autoimmunity, a condition in which structural or functional damage is produced by the action of first, immunologically competent cells, second, or antibodies against the normal components of the body. So it is protection against self, injury to self, also called as horror autotoxicosis. Predisposing factors, family history, certain HLA haplotypes, example rheumatoid arthritis, HLA-DR4. Features of autoimmune diseases, elevated immunoglobulins, demonstration of autoantibodies, deposition of immunoglobulins or their derivatives at particular sites like renal glomeruli, accumulation of lymphocytes and plasma cells at the site of lesion, benefit from corticosteroid or other immunosuppressive therapy, genetic predisposition, occurrence of more than one type of autoimmune disorders in an individual, higher incidence among females, usually non-reversible, that is chronic. Pathogenesis, antibodies may cause damage by cytotoxic or cytotoxic type 2 reactions. Example, autoimmune hemolytic anemia, immune complex type 3 reaction. Example, SLE, sensitized T lymphocytes type 4 reaction. Mechanism of autoimmunity. So first is antigenic alteration. Cells or tissues may undergo antigenic alteration as a result of physical, chemical, and biological influences such as altered antigen or new antigens may elicit an immune response. Example, drug-induced anemia, leukopenia, thrombocytopenia. Viral infections such as infectious mononucleosis. Bacterial enzymes such as neuroaminidase formed by myxoviruses. Mutation. Second, release of sequestrated antigens. Self-antigens that are present in closed system are not accessible to immune apparatus known as sequestrated antigens. So, immunological tolerance against these antigens is not established in fetal life. Example, Lenz protein of eye leaks out due to injury and immune response induced and cause tissue damage. Spermatozoa develop only with puberty. They are not recognized as self and are immunogenic when they enter circulation. Example in mumps or kites. The virus damages the basement membrane of seminiferous tubules, leading to leakage of sperms and initiation of immune response and subsequently development of orchitis. Cross-reacting foreign antigen. The similarity between some foreign and self-antigen is the basis of cross-reacting antigen theory of autoimmunity. Example, anti-rabies neural vaccine of infected sheep elicit immune response against sheep brain antigen, which may damage individuals' nerve tissue due to cross-reaction between human and sheep brain antigen. Streptococcal M protein and heart muscle share antigenic characteristics. Immune response induced by repeated streptococcal infection and can damage the heart. Nephrogenic strain of streptococci possess antigen found in renal glomeruli. Infection with such strain may lead to glomerulonephritis due to antigenic shedding. Molecular mimicry is due to presence of epitopes with identical peptide sequences in some infecting microorganisms and self-antigen that can initiate immune reactivity leading to autoimmune disease. Example, rheumatic fever, glomerulonephritis. Polyclonal B cell activation. Some stimuli non-specifically turn on multiple B cell clones and multiple non-specific IgM antibodies are formed. Such stimuli include chemicals, 2-mercaptoethanol, bacterial products, PPD and lipopolysaccharide, enzymes, trypsin, antibiotics, nystatin, bacterial infection, mycoplasma, viruses, EB virus, parasites, malaria. Forbidden clones, cells against self-antigen destroyed in embryonic life, and persistence of forbidden clones cause autoimmunity. Altered T or B cell function, enhanced helper T cell and decreased suppressor T cells function have been suggested as cause of autoimmunity. Classification of autoimmune diseases. There are total three. First, hemocytolytic, second, localized, that is organ specific, and third system, that is non-organ specific. So here are some examples of organ-specific diseases: brain, multiple sclerosis, thyroid gland, Hashimoto's thyroiditis, thyrotoxicosis, primary myxedema, stomach, pernicious anemia, pancreas, diabetes mellitus, insulin dependent, then adrenal gland, Addison disease, female, premature menopause. Non-organ specific, skin, systemic lupus erythematosus, scleroderma, Kidney, systemic lupus erythematosus, muscle, dermatomyositis, joints, rheumatoid arthritis, SLE. Hemocytolytic autoimmune diseases. First is autoimmune hemolytic anemia. So RBCs which are coated with antibodies are prematurely destroyed in the spleen and liver. Serologically, two types of anemias with cold and warm antibodies. So first, cold autoantibodies are complete antibodies of IgM class and they agglutinate erythrocytes at 4 degrees Celsius but not at 37 degrees Celsius. Seen in syphilis, primary atypical pneumonia, trypanosomiasis, and black water fever. Warm autoantibodies are incomplete IgG antibodies seen in therapy with sulfonamides, antibiotics, and alpha methyl dopa. Lab diagnosis home stage the red cells are incubated with anti-human immunoglobulin antiserum. If autoantibodies are present on red cells, cells are agglutinated by the antiserum. Second, autoimmune thrombocytopenia. Autoantibodies directed against platelets occur in idiopathic thrombocytopenic purpura. Syndromed purpura is an the instance of immune response against drug-induced neoantigens on platelets. Third, autoimmune leukopenia. Anti-leukocyte antibodies can be demonstrated in serum of patients with SLE and rheumatoid arthritis. Organ-specific localized autoimmune disease. So example, thyroid gland. Graves' disease, the majority of patients with thyrotoxicosis possesses antibodies to thyroglobulin. Symptoms are hypothyroidism, exophthalmos, tremens. Lab diagnosis, anti-TSH receptor antibody test. Hashimoto's thyroiditis, thyroid proteins and cells autoantibodies targeted against thyroid antigen leads to suppression of thyroid gland. Seen in middle-aged females, hypothyroid state is produced decreased production of thyroid hormones. Myasthenia gravis, characterized by abnormal fatigability of muscles due to malfunction of myonural junctions of striated muscles due to antibodies against its acetylcholine receptors. Thymus shows lymphoid hyperplasia. The lab diagnosis in that anti-acetylcholine antibody detection. Pernicious anemia, two types of autoantibodies are there. So first is directed against parietal cells of gastric mucosa and results in achlorohydria and atopic gastritis. Second is directed against intrinsic factor and prevents absorption of vitamin B12. So in that, antibody to intrinsic factor is detected. Good pasture syndrome and autoantibodies bind to basement membrane antigens on kidney glomeruli and alveoli of lungs, followed by complement mediated injury leads to progressive kidney damage and pulmonary hemorrhage. So in investigation, biopsies from patients are stained with fluorescent labeled anti-IgG and anti-C3b reveal linear deposits of IgG and C3b along the basement membranes. The ninth is the autoimmune orchitis can occur as a result of mumps. There is lymphocytic infiltration of testes with circulating antibodies to sperms and germinal cells. Third type is systemic, that is non-organ specific autoimmune disease. So one case study is there. A 27-year-old woman was referred to a rheumatology clinic with history of pain and swelling in the joints of hand and rash on the cheeks. So investigations, immunofluorescent test for anti-nuclear antibodies, that is ANA, showed homogeneous pattern anti-dsDNA antibody positive. Early cells were demonstrated on bone marrow biopsy. Diagnosis systemic lupus erythematosus (SLE) and treatment with low dose corticosteroid and showed improvement. Systemic lupus erythematosus. So we'll see it in detail. So pathogenesis is a chronic multisystem disease. Autoantibodies are produced against various tissue antigens such as DNA, nuclear protein, RBC platelet membranes. Immune complexes, self-antigen and autoantibody are formed, which are deposited in various organs. So symptoms are age and sex, women 20 to 40 years of age are commonly affected, and major symptoms are fever, butterfly rash over the cheeks, arthritis, pleurisy, and kidney dysfunction. Lab diagnosis, anti-nuclear antibodies. Anti-nuclear antibody positive in more than 90% of cases used as screening method. Anti-double stranded DNA, dsDNA, highly specific use for confirmation of cases. Anti-SM antibodies, detection of autoantibodies against various nuclear antigens by direct, indirect immunofluorescence assay. Most widely used an ELISA-based technique. ELI cell test no longer used because ELI cells are only found in 50 to 75% of the SLE cases. Rheumatoid arthritis. This is a symmetric polyarthritis with muscle wasting and subcutaneous nodules commonly associated with serositis, myocarditis, vasculitis, commonly seen in women. Major symptoms: age and sex, women 40 to 60 years of age. Main features are arthritis, chronic inflammation of the joints, begins at synovium. Most common joints involved are small joints of the hands, feet, and cervical spine. Other features, hematologic, cardiovascular, and respiratory systems are also frequently affected. Typically, there is a circulating autoantibody called rheumatoid factor (RF). A group of autoantibodies against the host IgG antibodies are produced, and they are called RA factor. ACPA, anti-citrullinated peptide antibodies are also produced. Autoantibodies bind to circulating IgG, forming IgM-IgG complexes that are deposited in the joints and can activate the complement cascade. Lab diagnosis: rheumatoid factor. RA factor can be detected by latex examination or ELISA. RA factor is IgM autoantibody directed against the Fc portion of IgG. Anti-CCP, cyclic citrullinated peptide by ELISA. This test detects human autoantibodies IgG against cyclic citrullinated peptide, which can be raised in rheumatoid arthritis. ACPA, anti-citrullinated peptide antibodies, is autoantibody to citrulline protein, is highly specific. Rose-Waller test to detect RA factor is of historical importance, no longer used now. Sjogren's syndrome is a triad of conjunctivitis sicca, dryness of mouth with or without salivary gland enlargement, and rheumatoid arthritis. Antinuclear antibodies and RF may be found in sera. Ribonucleoprotein RNP antigens SSA, RO, and SSB, LA, present on salivary gland, lacrimal gland, and liver, kidney, thyroid, leads to immune-mediated destruction of lacrimal and salivary glands, resulting in dryness of eyes, keratoconjunctivitis sicca, and dryness of mouth, that is xerostomia. Lab diagnosis: detection of SSA, anti-RO, SSB, anti-LA antibodies by indirect immunofluorescence assay.
Hope you find this session useful for your understanding and for your exams. Thank you.